Welcome to the home clinic. Today we're going to go over how to take an accurate blood glucose. Today we have our patient Robert, and he will be sacrificing a finger for us today. So first thing you want to do is ask your patient if they're comfortable with getting their blood drawn. Are you okay with us drawing blood for your glucose?
Yes.
After that, make sure you have your personal safety equipment on, in this case gloves, and all of your equipment. Today your equipment will include a Sharps container, your lancet, a Band-Aid, an alcohol swab, gauze, a glucometer, and a glucose strip. Notice that I have the glucose strip in the glucometer already, but it's not fully pushed in. So the side that has a hole in it that looks more like a microchip is the side that goes into the glucometer. And you don't want to push it fully in, because if you wait too long once it gets pushed in, you'll get an error. So in order to avoid that, we want to have it ready to be pushed in and slightly inserted into the glucometer before we start. So the first thing we do is we get an alcohol swab and we get the patient's hand. Now, you always want to choose one of these two fingers, the third or fourth finger, and you never want to be right on the pad of the finger. The pad of the finger is the most sensitive part of the finger. It's also the most calloused. So we always want to go on the outsides of these fingers. Never do it on the outside of the pointer finger or the second finger, because that is always going to be one of the most calloused places of their hand. In order to only have to stick your patient once, we're going to always try to do it on the third or fourth finger. Once you have the area disinfected, take your lancet and take off the cap. Once the cap is removed, you tell the patient to count to 3, and they're going to feel a slight pinch. So count to 3 for me.
1, 2, 3.
And once you use the lancet, begin to milk the finger. Get a good pile of blood before you begin. Now you fully insert your glucose strip into the glucometer. You look for the screen to turn on. It is ready for blood. You put the glucometer at an angle so you let the blood be sucked in through capillary action. Then you let it think. While it's calculating, make sure to stop the bleeding using a piece of gauze. You'll get your number. Ask the patient to apply pressure to the site. Prepare the bandage. Then ask the patient to remove the gauze so you can bandage the finger. And that is how you take a blood glucose. Oh, I didn't dispose of the Sharps. Maybe I did that in the other one.
Well, we can edit it. Okay, yeah.
Always remember to dispose of your Sharps and the glucose strip.